Good morning, everybody. This is Dr. Marianne Pinkston with The Better Life with Dr. Pinkston, and I am bringing you a second part to the first part with Dr. Warren Lesser, who is head of Magna Pharmaceuticals, who you know very, very well for the De Novo and Nufola that I talk about, the methylated B12 and methylated folate products, ALA and other things. And we have talked much about treatment of MTHFR and detoxifying the body. We spent some time last time talking about longevity. How do you live better, live longer? Also about how to choose wisely when you are buying your supplements and products. And so we will continue that today. Dr. Lesser, welcome in again. It's nice to see you as always.
Thank you. It's good to see you. Good to be here. What a wonderful day. I don't know what it's like down in San Antonio, but here in Louisville, we're having San Diego weather today. It's
you're so
low
lucky.
humidity.
We had a heat index of 117 2 days ago. We're miserable, but it's okay. We're inside. We're happy.
Oh my. Right. Make sure the AC is working for
Absolutely,
sure.
we hope. So welcome in again. So let's continue where we left off last time. If you want to kind of recap and get us going again.
Sure, we'll do. So our whole purpose here is to talk about how to help patients be more healthy. Of course, we are in pharmaceuticals and we sell dietary supplements too. So we have products to sell, but we have a philosophy where we sell our products for very reasonable prices. So we're not looking for excess profit. So really, from an altruistic standpoint, and we'll talk about how we decide what products we're going to bring to market in a little bit. But I really want to say that last time we talked about really where the companies that make dietary supplements, where do they get their raw materials? Do they get them from places that have very poor water supply, very poor sanitary conditions? And then when they come into the manufacturing plant here in the United States, for example, I just want to say two things. Your GMP flows all the way from raw materials through product shipment. That's what the FDA looks at when they come in and they inspect us. But a couple of things about manufacturing that your lower grade dietary supplement people don't have. They don't have expensive clean rooms, and they don't have perhaps water facilities or water processes where even the chlorine is removed from the water. It's so pure. So these are things to think about. And there's a marked difference between buying a dietary supplement that's made to GMP standards. So we touched on that last time, and I just want to add that. And then we talked about really, we want to talk more about what we decide to put into our bodies. You are what you eat, the old saying, but really homocysteine and glutathione are the two substances we keep harping on because too much homocysteine is a marker for so many diseases. Yes. In fact, as we've said before, it's the main culprit for cardiovascular brain disease, strokes, arterial sclerosis can make diabetic patients, their peripheral neuropathy worse.
Yes.
It can also affect mental and cognitive functions. For example, give more anxiety, lead to depression, impair thinking, lead to dementia. Even Alzheimer's, ALS, Parkinson's, and autism are involved with too much homocysteine. So we want to be very conscious. And I think really and everything I'm quoting in this presentation is from really good peer-reviewed medical journals. For example, Drug Design, Development, and Therapy, Current Clinical Pharmacology, Austin Journal of Pharmacology and Therapeutics, European Journal of Medical Genetics, Current Medical Research Opinion, Psychiatric Care, etc. And one of the comments that they make here is that it's very strong. The proportion of B12 and folate in our bloodstreams, right? The proportion of those two substances to homocysteine, that's inversely associated. So right now we can see just from this research, well, what can I do? I can make sure I've got enough B12 and folate in my bloodstream so that I can keep my homocysteine lower. And then we talked about glutathione, which is the second substance that we can take some control over with respect to predicting our future health. And the one statement that I really like here from integrative medicine is that the importance of glutathione cannot be overstated. It shields our cells, our macromolecules from reactive oxygen and nitrogen species. They're talking about free radicals that come into our bodies. So we want glutathione to clean up all the garbage, the persistent organic pollutants, POPs. Some of these POPs stay in our bodies for a lifetime. They're industrial waste, they're chemical waste, and we cannot get rid of them. So glutathione can help clean those up. So where we left off last time, we started to talk about how do we raise our glutathione levels? Well, what's really important here is that if you look at our stomach milieu, it has a gastric pH of 1.2. It's a very strong acid. I mean, I think about how wonderfully we're made and the fact that an acid that's that strong will eat paint off a car, right?
Yeah.
Now, that doesn't eat through our stomach walls.
Absolutely.
And then what's even more amazing is that a few centimeters later, when the gastric juices dump into the duodenum, the pH changes to above 7, to an alkaline environment. So that's because some substances we eat need an acid environment to break down, some need an alkaline. Now, glutathione typically does not survive the stomach milieu of 1.2. Now, there is a product I know that we talked about where it's designed to release in the small intestine into an alkaline environment. So when it gets into the acid environment, it's protected, much like an enteric-coated aspirin.
Absolutely.
Enteric-coated aspirin is designed to dissolve in the small intestine, not the stomach, because that's where the direct contact with mucosa causes irritation. But anybody can do a Google search, aside from a very specialized supplement that's designed to dissolve in the small intestine. You can do a Google search and come up with some really good references about how to increase glutathione levels. Here's one that says 12 effective ways. The number one item they list: get plenty of folate, B6, and B12. And they specifically state methylcobalamin, because methylcobalamin is the active form of B12. We've talked about this before, Dr. Pinkston.
Yes.
If you're taking cyanocobalamin in your daily vitamin supplement, I mean, forget your diet. Your cyanocobalamin doesn't do very much good. It has to be the methylated form, and that's
what most vitamins. I don't think people realize most vitamins you buy just right off the shelf at the at the local stores and health food stores and whatnot are cyanocobalamin, not methylcobalamin. So that's what you're telling us. Very important.
Exactly, and you can take that concept a little further here. Now, folate. We're talking about folate. We're going to talk about our products in a few minutes, but methylfolate, L-methylfolate is the form that we use. Again, methyl, because it is absorbed. Folic acid is what you see in most vitamins. It's poorly absorbed by a large segment of our society. Vitamin B6, what do you get mostly? You see in your dietary supplement, on your multivitamin, you see pyridoxine. We use pyridoxal 5-phosphate. These are the active forms. So you want to take active forms of vitamin supplements. So in addition to them saying that make sure you get these B vitamins, alpha lipoic acid is another one that raises your glutathione levels. Guess what? Alpha lipoic acid is in Nufola.
Yes.
Plenty of sleep, drink bone. I don't know about bone broth. I've never had it. I know about drinking coffee, and I know about reducing stress and positive thinking, how that can really affect your long-term health. Now, working out regularly.
Yeah.
So working out regularly actually helps increase your glutathione and helps reduce your homocysteine. One of the things I want to say here is that there's more published articles today about weight resistance or resistance training, weightlifting. And I was reading in Healthline where the male who's around 30 years of age, between 30 and 70 years of age, they lose 10% in body weight of skeletal muscle. So, for example, if you're a 200-pound man, you're going to lose 20 pounds in skeletal muscle by the time you're 70 years of age.
Yep.
Now, that's why you see so many people, they're frail, they're elderly, they can't move around, they have a lower quality of life, they don't ambulate as well, they can't do what they did before. When you look at them, they're bags of bones. I mean, they're skinny. And that's what we have to do. We have to take responsibility as we get older to not only do aerobic exercise, but weight resistance training. Absolutely. And when you do the weight training, there are myokines that are released. Now, if you've never done weight training before, get some instruction about it. I love it. So as a part of life for me, I've been doing it. I'm 70. I've been doing it all my life. And it makes a big difference in what I'm able to do today. But what happens are when your muscles release myokines, and the myokines increase the communication with your other organs, like your brain. After you work out, you feel better. You feel more alert. They help break down your adipose tissue. They help the structure of bone. They help your liver, your gut, pancreas, even your skin function better. Myokines are released when you do muscle or weight resistance training. And look what it says here. And this comes from International Journal of Preventive Medicine. This is a 2021 article. Yes. Okay, it improves your cognition, your ability to think, your lipid and glucose metabolism, your browning of the white fat. okay, of course, your muscle growth, and inhibits tumors. And it says specifically myokine IL-6 mediates the anti-inflammatory effects. In other words, increases the anti-inflammatory effects, and it reduces abdominal adiposity. So we all, as we get older, we can work on reducing abdominal adiposity. So that's the muscle training part of it. The other part is aerobic exercise, and the predominant literature that I read talks about moderate aerobic exercise, not running. Marathon runners are great, but even moderate aerobic exercise for a period of 12 weeks, excellent study, reduced cardiovascular risk by up to 50%, lowered bad fats, and raised HDL, which is your good fat. So when you look at the substances we're talking about, homocysteine, glutathione, those are really important, and exercise and diet and B vitamins all play a very important role in choices that we can make to increase our chances for long-term health and even longevity. Longevity, I'll talk about in just a few minutes, having to do with omega-3s. But I would like to say that I'm not going to apologize at all, because we don't really talk about our products. But what might be of interest to you and your listeners is, how do we decide how to come out with a product? And I mentioned earlier, you've got to make a little bit of money for sure. But when you look at the prices on our products, they're mostly about $1 a day or even less. They're not expensive.
Correct.
We ask ourselves questions, because if we do nothing but make some money, we haven't done very much in our lives. But if we can come out with products that have low side effects, that are very safe and efficacious, then we really can do something. Yeah. And so the questions we ask ourselves about Nufola and DeNovo Plus B12 is that, well, can you increase cardiovascular effectiveness and efficiency? Can you help heart and blood vessels function better? Can you improve nerve function, especially for diabetic patients who have, compromised circulation in their legs and feet?
Correct.
Can we give people more energy? Can we help them think more clearly? Can we give them a better outlook on life? Can we do this without any side effects or very mild side effects? Now, when I take Nufola, I do get some temporary, a little bit of flushing because of the vasodilation. Mm-hmm. I know it's working. I know my capillaries are getting a little bit larger. My blood flow is increased. It's not uncomfortable, but I know it's working.
And it's not an allergic reaction. People think it's an allergic reaction, and it's not. And it's very mild. It will go away. It means it's working, as you said.
Exactly. Now, there's a bad flushing you get, for example, with nicotinic acid.
Yeah.
That's not slow release. You can get a bad flush and feel kind of sick from it.
Yeah.
But I'm talking about something that's very mild.
Very mild.
So if you could deliver all these health benefits with little or no side effects, because it is a dietary supplement, so it augments the function. We try to augment the normal function of our bodies, rather than intervening or blocking the function of one part of what our bodies do. We're looking for a better quality of life. And here's the question. In a personal budget, for all these benefits, can anybody find $1 a day?
Yes.
I mean, for crying out loud,
yes.
That's what we're talking about, really, with respect to cost.
Yes.
Here's what our two products look like, Dr. Pinkston, Nufola and DeNovo Plus B12. Nufola comes in a bottle of 60. Nufola DeNovo in a bottle plus B12 in a bottle of 30. Yes. And the formulas are these. They both contain, as we've been talking about, L-methylfolate and methylcobalamin. In Nufola, we add the absorbable active form of pyridoxal 5-phosphate, which is B6, and we also add 300 milligrams of alpha-lipoic acid. Yeah. I mean, honestly, our medical director told me, he said, I take one of each of these. I take Nufola. Sometimes I'll take DeNovo Plus B12 because they're just healthy. I mean, they're just really healthy. But really, the formulas are designed, Nufola is designed more for patients with peripheral neuropathy to help circulation. And we have a lower dose of L-methylfolate, even though you can take 2 of these a day.
Right.
DeNovo Plus B12 contains a higher dose, 15 milligrams of L-methylfolate, and you can take more than 1 a day. The dosage is typically 1 a day. And by the way, L-methylfolate and methylcobalamin are the only 2 forms that cross the blood-brain barrier. That's what we're looking for in DeNovo Plus B12, right, because we're gearing this product more towards cognition, people who have depressed feelings. And what we want to do here is really increase serotonin, dopamine, and norepinephrine. Those are the neurotransmitters, the positive neurotransmitters that help us think better, help us think more clearly, Absolutely. Have more positive thoughts.
Absolutely.
And by the,
got it.
Right. And that's what really antidepressants do. They do it through an interventionary method where they block the reuptake of serotonin, for example.
Yes.
We're just trying to help the production of serotonin on the other side. And we can do that without the side effects of the antidepressants. But we're never going to advocate. Like we showed on that one case study last time we talked about, the woman after 4 months, she had depression for 20 years.
Amazing, yes.
After 4 months, she could come off her antidepressants and just stay on L-methylfolate. But we never want to advocate that anybody just go cold turkey and stop their antidepressants. That's got to be a gradual process. But take these after breakfast or lunch. Take 1 or 2 Nufola. Don't take them at night because the B vitamins will give you more energy, will make you more alert. And when it's time to go to bed, we don't want to be staring at the ceiling for sure,
exactly. Right? This is true.
So the other part of marketing a drug has to do with coming up with something catchy that our physician customers, our nurse practitioners and PAs as well can remember. And so we came up with the acronym here called HANDS. Now, the whole concept here is that we want to help the physician. We want to help the physician extend her or his healing hands to the patient long after the patient leaves the office. We know that patient compliance is a big deal. We go to the doctor tells us what to do, we leave, and we do about half of it, or if that much, right?
Absolutely. And Dr. Lesser, this may be a good point. This is for us to take over to the next side. We've got about a minute left, and I want, before we take our break, and then we'll come back, but I definitely want people to be able to find you. magnaweb.com, very easy, magnaweb.com, and I have links to everything. If you go to drpbetterlife.com, not only do we have our previous shows, I want everybody to go back and watch, but I do have about 3 years of content now, if you can believe that. And so I definitely want us to come back on the other side real quick so we can talk about all this. So magnaweb.com, go check it out. We got a little commercial here that'll highlight that as well. So join us back on the other side. We'll be right back.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. I'm Dr. Marianne Pinkston. Again, this is A Better Life with Dr. Pinkston, and I have Dr. Warren Lesser here with Magna Pharmaceuticals. We've been talking about his fantastic products of Nufola and De Novo, and so you had a great acronym I think you were about to give us now, HANDS. Tell us more about that.
Right. So we're trying to help the physician extend her healing hands into the patient's life after they leave the office.
Yes.
And one of the issues that we really have is that we try to, with these dietary supplements, with the Nufola and De Novo Plus B12, we try to fix and correct the underlying pathologies, including physiology and anatomy. We talk about structure of nerves.
Yes.
We try to rebuild those neurons and the capillaries and not just treat the symptoms. Because when you treat the symptoms, that doesn't really mean the patient's going to get better long term. So HANDS, H stands for homocysteine, lowering homocysteine. We've talked about that. Raising antioxidants like glutathione, increasing nitric oxide, because what do? You get increased circulation, increasing the neurotransmitters dopamine, serotonin, and norepinephrine. We want to raise those so we have the positive neurotransmitters, especially when people have feelings of sadness or depression.
Right.
And who doesn't want more strength and stamina? And that comes from the ingredients in Nufola and De Novo Plus B12 as well. So I know we only have about 6 minutes, but I want to say just a couple things on HANDS. Homocysteine decreased. I want to say that one thing that we haven't talked about before is that 32 to 65% of the population in the United States lacks methyltetrahydrofolate reductase, which is the enzyme that's responsible for breaking folic acid down to folate. And we've got to have folate, and it's an essential vitamin, right? Yep. So the 32% would be more on the Caucasian side, where the 65%, remember, it depends on ethnicity, would pertain to Hispanic and even an Asian or somewhere in between, depending upon the study.
Yes.
That means that 1 out of 3 Caucasians and 2 out of 3 Hispanics are going to have MTHFR. That's a big deal.
It sure is.
If you're not getting the folate, you're getting higher homocysteine, and you're having adverse health effects, lower energy. It goes on down the line as we've talked about.
Correct.
And then I'll just touch on antioxidants. That methylcobalamin is the activated form that regulates inflammatory factors, counters oxidative stress. So does B6. So does alpha lipoic acid down here, potent antioxidant. Alpha lipoic acid is in the Nufola.
Right.
Reduces oxidative stress, improves nerve function, and methylcobalamin has been shown to increase glutathione levels.
Perfect.
We know that. Nitric oxide, we know that when we increase nitric oxide, we increase peripheral circulation, and that's been linked to reduced wound healing. Now, wound healing is a big deal for patients who have diabetic peripheral neuropathy. They get open sores, they don't heal. So what we want to do is take nutrition, take supplements that are going to help increase nitric oxide, increase blood flow, increase wound healing. And then, so that's the N in nitric oxide. And then the D, of course, especially in de novo plus B12, that we want to have something that crosses the blood-brain barrier, the methylated forms, L-methylfolate, methylcobalamin, to increase those neurotransmitters, to protect the brain from toxins, but also to enhance mood. Okay. Well, interesting. People who are depressed have increased levels of homocysteine. So the other part of this is that those substances help to lower homocysteine as well. And as I mentioned, this is the reason we have more L-methylfolate in de novo plus B12. Yes. And the last one, HANDS, S is for strength and stamina. And these references here all talk about the fact that methylcobalamin, alpha lipoic acid, even L-methylfolate, alpha lipoic acid, as I stated, all increase strength and stamina.
Yes.
So the other substance that we talked about that is kind of a corollary to the Nufola and de novo plus B12 is omega-3. Now, we have a really good omega-3. Now, what research has shown is that people need to take about a gram a day of docosahexaenoic acid, DHA, and icosapentaenoic acid, EPA. And the perfect ratio is 3-2 with those. But I don't want to go through, I know we're running out of time, but we look at huge studies. Here's one with 280,000 participants. Are you kidding me? Here's over 100 clinical studies. We're lowering cholesterol, we're reducing triglycerides. There's an inverse association between fish consumption, blood levels of omega-3 fatty acids, and morbidity and mortality resulting from coronary artery disease. And there are other diseases here that are listed as well. So the other interesting research about omega-3, and this is a 2022 article. I found this fascinating. And they did an analysis of 573 studies on the effects of omega-3 and telomeres. Now, what is a telomere? A telomere is the protective cap at the end of human cell chromosomes. Now, the length correlates with health and lifespan of the individual. Right. Telomere length is shortened when we have oxidative stress and chronic inflammation. What does that mean? Well, that means the more junk I bring into my body, the more reactive oxygen species, the more oxidative stress I have, the more systemic inflammation I have, the shorter I'm going to make my telomeres. Right. So what does that mean? That means the shorter the life of my cells is going to be. Well, if your cells die, your body's not going to live, right?
That's right.
So what's fascinating here, and I won't go into all the details, but they went through 573 studies. They threw out all the studies that had bias, and they came up with a p-value of 0.02.
Wow.
Now, 0.05 is really usually considered statistically significant, so this is even better.
Yes. When
you talk about statistical significance in those studies, that the effect of you take omega-3s, you have omega-3s in your blood, and you're going to have increased telomere length. They do say, the authors do say, larger clinical trials are needed, so it's an ongoing field, but I find it extremely interesting. And for me, if there is a chance I'm going to increase my telomeres by taking omega-3, not only am I going to lower my triglycerides and improve my lipid profile, but if I can increase my telomere length, that's a no-brainer. I'm taking it. Especially if one omega-3, Magnum omega-3 costs 35 cents. So if I take one a day,
So, with about a minute left, Dr. Lesser, how can patients get in touch with you and get all of these things?
Yeah, okay. Well, they can go on to magnaweb.com and they'll find that they can buy our products for about $1 a day or even less, 50 cents a day.
Yeah.
We don't have any gimmicks where we try to give people free products and they have them sign up for automatic shipment.
Right.
That's a definite no in our mind. So take the products. If they work, you're going to keep buying them. So that's the whole premise of it. And we try to give value. But remember to eat well, take plenty of fresh fruits and vegetables, get on an exercise program, take plenty of B12 and L-methylfolate, and then make sure those stay in your diet. That way you can reduce homocysteine, increase glutathione, hopefully increase and they take omega-3 too. Take a good one, not one with omega-6.
Absolutely.
And we'll talk about that more.
And we will. We will pick up all this and we will go forward with it. Dr. Lesser, thank you so much. And everybody, please go to drpbetterlife.com. You can find magnaweb.com, all the products as well, and all of our previous shows. I would love to have you back so we can talk about all this. Dr. Lesser, have a great week. Everybody have a wonderful week. Thank you so much.
Thank you very much. Thank you.